mynews.studio.
A river that used to be filled with malaria-carrying mosquitoes now runs clear. How did Egypt manage to completely wipe out the disease?
Today's date is 2025-11-18. Egypt, once deeply affected by malaria, has just been certified malaria-free by the World Health Organization. Only 5 African countries have reached this point. So, how did Egypt achieve it?
This story goes back many years. After the Aswan Dam was completed in 1969, Egypt actually saw more mosquito breeding grounds. Malaria became a constant problem. But things really started to change in the early 2000s, when the government intensified its anti-malaria strategies.
Wait, can we pause there for a second? The dam led to more standing water, which means more places for Anopheles mosquitoes to breed, right?
Yes, that's right. That increase in breeding sites made malaria especially hard to control. Even as recently as 2014, there was an outbreak in Aswan. The authorities responded quickly, targeted spraying, distributing insecticide-treated nets, and, crucially, working closely with Sudan to prevent cross-border spread.
Cross-border spread sounds like a major issue. Why was working with Sudan so important in this context?
Egypt and Sudan share a long, open border. Without joint action, malaria could have kept returning, which would have set back Egypt's own efforts. So during the 2014 outbreak, both countries coordinated spraying and shared information about new cases. It's actually a good example for other countries facing similar cross-border health risks.
After that outbreak, did Egypt change how it tackled malaria?
Yes, there was a definite shift. Starting in 2016, Egypt scaled up its efforts. The government formed the High Committee for Integrated Vector Management, invested in surveillance, and made a point of protecting the most vulnerable groups, like young children and pregnant women. Health workers got ongoing training, and public awareness campaigns were launched nationwide. By the end, about 84% of people knew how to prevent malaria.
That's a really high level of awareness. But on the technical side, how did Egypt manage to detect and treat cases so quickly?
Surveillance was central. They could identify 98% of malaria cases within 48 hours after symptoms appeared. That kind of speed is essential to prevent further spread. Once identified, 91% of cases received treatment fast. At the same time, Egypt kept up vector control, rotating insecticides using indoor spraying, nets, larvicides, and also making changes to the environment.
Insecticide resistance has caused setbacks in other regions. How did Egypt handle that?
They avoided relying on just one approach. By rotating insecticides, they slowed down resistance. They also combined chemical with environmental management and biological controls. The key was to stay flexible and adapt as needed.
Stepping back a bit, what about countries with weaker health systems? Is Egypt's model something other places can actually use?
Community involvement and strong surveillance made the difference. Training local health workers, teaching the public, and linking malaria control to general health services. The surveillance tools Egypt used were simple and could be scaled up, so even countries with fewer resources might adapt them.
Now that Egypt is malaria-free, how do they prevent a comeback, especially with things like regional instability and the effects of climate change?
They keep up strict surveillance, make sure health workers stay trained, and the High Committee continues to oversee vector management. Egypt also maintains cooperation with neighboring countries to watch for imported cases. As new risks appear, like changing mosquito habitats due to climate, strategies are updated. Public awareness campaigns keep people informed.
So Egypt isn't just celebrating and stopping. They're actively making sure malaria doesn't return.
That's right. WHO certification isn't just about 3 malaria-free years. Egypt had to show it could quickly spot and control any new case, and that the system could handle future threats.
Malaria still causes hundreds of thousands of deaths every year, mostly in sub-Saharan Africa and South Asia. What's the main takeaway from Egypt's experience?
It proves elimination is possible even in tough situations. The combination of strong leadership, community participation, reliable surveillance, cross-border work, and well-integrated health systems can overcome even stubborn diseases. The exact approach might differ, but the core lessons are widely relevant.
Looking ahead, can other countries really follow Egypt's path?
There are real hurdles: conflict, weak health systems, limited funding. But Egypt's story shows that progress is possible with evidence-based strategies, persistence, and cooperation. The main thing is to adapt the lessons, not simply copy every step.
As climate change shifts where mosquitoes live, the need for adaptable, resilient systems is only going to increase.
Exactly. Egypt's journey isn't just a national story. It's a signal to the world that elimination is within reach when the right tools and commitment are in place.
Egypt's malaria-free status marks both an achievement and a starting point. What steps will other countries take next?
That's the big question, and it's one we'll be keeping an eye on.
Thank you for joining us for this close look at how Egypt ended malaria and what it could mean elsewhere.
We hope you found this story as informative as we did. Thank you for listening. This episode was brought to you by mynews.studio. You can try it now for free.